In Chapter 16, know the incidence of death and the increased cost to employers from cigarette smoking. Also know what nicotine does physically to a person, as well as the associated diseases. And be able to answer these questions. Be able to identify diseases associated with smoking. Know that increased cholesterol levels and decreased circulation can also be attributed to the use of nicotine. Know the physical risks that are faced by tobacco chewers. Know what supplements may be useful during withdrawal and detoxification from cigarette smoking. Know what may be helpful in preventing weight gain associated with stopping smoking. Know what supportive therapies may be helpful in stopping smoking, such as acupuncture, hypnosis, massage therapy. Know what recent studies suggest may make people vulnerable to both alcohol and tobacco addiction. And finally, as reported by the National Institute on Alcohol Abuse and Alcoholism, know that more than half of patients in treatment for alcohol and other drug dependence die from tobacco-related illnesses. In Chapter 17, know whether eating disorders generally co-occur with alcohol and other drug use disorders. And know the general characteristics of anorexia and bulimia, as well as the general age of onset. Know what the term comorbidity means and how it is used related to eating disorders. Know what common questions arise when treating co-occurring alcoholism and eating disorders. And know what is generally regarded as the first-line treatment of choice for eating disorders. In Chapter 18, know whether dopamine and serotonin relate in any way to pathological gambling. Know the 10 identified behaviors, 5 of which must be exhibited for pathological gambling disorders diagnosis, that are listed in the DSM-4. And know whether gambling problems among those in treatment for substance abuse are generally the same, lower, or higher than in the general population. In Chapter 19, know the characteristics of an individual with sex addiction and compulsivity, and know the concerns commonly encountered during a sexual addiction intervention. In Chapter 20, know the characteristics of a codependent individual, and know whether treatment for codependency works best when it is treated as a primary or secondary disorder. In Chapter 21, know the group of individuals most susceptible to internet addiction. In Chapter 22, know what dual diagnosis is, as well as its most common symptom, and know what is included in discharge planning for a dual diagnosis client. In Chapter 23, know and understand the differences between the traits of an effective naturally therapeutic counselor. Be able to distinguish between those if you're given the name of, for example, empathy, and know what makes up the empathy trait. In Chapter 24, know and understand the 3-pronged counseling process, be able to distinguish between all 3 of them, and be able to identify patterns of negative thinking, for example, overgeneralizing. In Chapter 25, know helpful and unhelpful statements in a group counseling process. Know about the advantages of groups, how to fulfill individual needs through the group process. Know about the limitations of groups, and also know how to structure the group relationship, such as including time limits, counselor versus client agendas, role limits, all 5 of those items. In Chapter 26, understand the stages of development in the CD-affected family, and know the process to follow in a family and/or couples counseling program. In Chapter 27, be able to identify behaviors associated with the progression of adolescent chemical dependency. understand the various treatment elements, such as negotiated contracts with the adolescent, and know who should be involved in the development of an aftercare plan. In Chapter 28, know what we can learn from failure, and also know the goals of personal growth examination. In Chapter 29, this is important information if you are going to be certified as a registered addiction specialist. If you are taking this exam for a different certification, then you do not need to know the RES Code of Ethics or the RES Scope of Practice. There will be no questions on the exam on this chapter. But again, if you're testing for RES certification, you should know the information within this chapter. In Chapter 30, you should understand the meanings of relapse and recovery. And you should understand the situations when relapse is more likely to occur, what questions should be asked, and factors that will assist in a sober recovery. In Chapter 31, understand the components of psychoanalysis, understand the characteristics of person-centered therapy, understand the characteristics of rational emotive therapy, understand the characteristics of behavioral therapy, and understand the 3 R's of reality therapy, and be able to distinguish between each one of those therapies. Chapter 32 has some very good information for the counselor. Assertiveness for the counselor, good information for personal and professional growth of the counselor, but there will be no questions on the exam on this chapter. Chapter 33 is a very important chapter, and you should know this very well. This deals with laws, ethics, and confidentiality, and you are likely to get a good number of questions on the information in this chapter. You should know and understand the meanings of all of the terms and legal issues involved in treatment throughout this chapter, especially those identified in bold type, such as standards for client care, implied contract, and other terms. You should understand very well the laws related to confidentiality and under what circumstances information about a client may be released. Understand the reasons for the tradition of anonymity in Alcoholics Anonymous. Understand the professional counselor's obligations to other professionals, and understand the ethics of information that may be disseminated in publication and public speaking. Chapter 34 is another important chapter, and between Chapter 33 and 34, ethics, confidentiality, and sexual harassment, these are the areas that get most counselors into trouble by the certification board or licensing board. So you want to make sure you know this information very well. In Chapter 34, you want to make sure you understand the components of the protections afforded by the Civil Rights Act, the Age Discrimination in Employment Act, Americans with Disabilities Act, and the Equal Pay Act. Know each one of those, know what the components are, know how to distinguish between them. Understand what constitutes sexual harassment, in what circumstances it may occur, and what, according to the U.S. Equal Employment Opportunity Commission, is the best tool to eliminate sexual harassment in the workplace. This last section is going to be a combination of the information contained in Chapter 35 and what is contained in the actual TAP 21 publication. You do not need to have the TAP 21 publication because everything that we are going to test on is contained in Chapter 35. So this part of the exam, counselor competencies, will take up about 20% of the questions. So you should take the time to study Chapter 35 and know it very well. Make sure that you fully understand and are able to distinguish between the counselor competency standards of the 12 core functions and TAP 21. Know very well and understand each of the 12 core functions and be able to distinguish between each of them. Know and understand the meaning of every one of the 40 terms within the TAP 21 glossary of terms, and again, be able to distinguish between them. And finally, know and understand very well the 8 counselor competency criteria identified within the TAP 21 standards, such as clinical evaluation, treatment planning, etc. And remember, Chapter 35 is a big part of the exam. About 20% of the exam questions, so you're just going to have to memorize the information in there, as we just pointed out, and then you should do fine on the information being tested on in this chapter. In wrapping up this tutorial, remember that you will only be tested on the material in the 3 books identified in this tutorial. If it is not in these textbooks, it will not be on the exam. And also remember that if there is a conflict between what you previously learned and the textbook material, answer the questions based on the information in these books. The exam is not easy, but if you know the material in the books, and as pointed out in this tutorial, you should pass the exam. And by passing this nationally developed and scientifically validated exam, you will demonstrate that you have the knowledge and skills to be a competent counselor in an alcohol and other drug or substance use disorder treatment setting. Good luck, and keep up the good work that you're doing in this honorable profession.